Engela Hospital is the largest in Ohangwena region, serving a large catchment population of 180,000 people. For the past years, the hospital has been operating with only 5 doctors, resulting in patients spending many hours in the queue or sometimes even going back home without being attended to. Recently, a group of 12 medical doctors, including 2 specialists, were recruited to address the shortage of doctors. Ohangwena Health Director John Hango says the filling of medical officers' posts has significantly improved service delivery at the district hospital.
Now that we have more doctors, we've started with the new arrangement where at 7 o'clock we have nurses already working at the OPD to prepare patients to be seen by the doctor. At 8, we already have doctors coming to OPD straight. As others are going to the ward, the others are in the OPD, and that makes the queue to go faster, and the community is happy about that. Especially the patient waiting time has really improved.
According to Senior Medical Officer in charge of the hospital, Mati Kanjimi, the recruitment of the additional doctors has eased the pressure on doctors. The doctor-patient ratio has now been drastically reduced from 36,000 to 16 patients. Due to its geographical location, the hospital also serves Angolan nationals living across the borderline.
There's been significant improvement because we have 2 of our medical officers in the nearby health facilities, that is Onga and Odibo, which means that they are actually catering for those communities who usually previously would refer patients to the hospital. So there is a measurable improvement in terms of reduction of number of patients that are coming to the OPD.
I think we are doing very well. Since we got extra doctors, I think we have 12 doctors now in the hospital. And what we have seen is that very rarely you will see a patient waiting for more than 2 hours nowadays. The patients are actually being seen as they are screened. Shortly after being screened, they are seen by the doctors, they get their treatment and go home. And if you go to OPD, in the past you used to find all the benches full of patients waiting to be seen by doctors. If you go to OPD now, you won't find people waiting to be screened. Actually, patients have been screened and you just see a few people waiting to be seen by the doctors.
Some patients who regularly visit the hospital also expressed their satisfaction on the service delivery following the appointment of additional medical officers.
Now the queue is fast because there are many. Back then, you would come as early as 8 in the morning and only leave around 4 in the afternoon. Now you can leave even at 10 in the morning and the service is great. We are being served well these days. At least doctors have now sufficient time with us and you can really feel afterwards that you are indeed treated, unlike those years.